Hello everybody. Welcome to number 1 Doctor channel. Today video is about brain tumors, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like and share our videos and subscribe to our YouTube channel number 1 Doctor, and join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free. Share and be shared. Today we will talk about brain tumors. Most intracranial tumors are metastatic, rather than primary, which is not surprising since the brain is one of the 4 favorite destinations of blood-borne malignant cells along with bone, liver, and lung. About half come from the lung. The next most common are breast and melanoma. The symptoms are those of a space-occupying lesion detailed in the next paragraph. A further clinical clue is that the patient has had one of those cancers. About half of primary brain tumors in the adult are gliomas. Meningiomas account for about 20. The most malignant intracranial tumor is glioblastoma multiforme, a type of glioma. Meningiomas are usually benign. The treatment of brain tumors is typically multimodal, including surgery, radiation, and chemotherapy for those cases where the blood-brain barrier has already been breached. Brain tumors may offer no clue as to location if they press on a silent area of the brain. The only history will be progressively increasing headache for several months, worse in the mornings, and eventually accompanied by signs of increased ICP, blurred vision, papilledema, projectile vomiting, and at the extreme of the spectrum, bradycardia and hypertension due to the Cushing reflex. Brain tumors can be visualized very well on CT scan, but MRI gives better detail and is the preferred study. While awaiting surgical removal, increased ICP is treated with high-dose steroids, i.e., dexamethasone, trade name Decadron. Clinical localization of brain tumors may be possible by virtue of specific neurologic deficits or symptom patterns. For example, the motor strip and speech centers are often affected in tumors that press on the lateral side of the brain, producing symptoms on the opposite side of the body. People speak with the same side of the brain that controls their dominant hand. Other classic clinical pictures include the following: tumors at the base of the frontal lobe produce inappropriate behavior, optic nerve atrophy on the side of the tumor, papilledema on the other side, and anosmia. Foster-Kennedy syndrome. Craniopharyngioma occurs in youngsters who are short for their age, and they show bitemporal hemianopsia and a calcified lesion above the cilia on CT scan. Prolactinomas produce amenorrhea and galactorrhea in young women. Diagnostic workup includes ruling out pregnancy test, ruling out hypothyroidism TSH, determination of prolactin level, and MRI of the cilia. Therapy with bromocriptine, or a similar drug, is used in most cases. Transnasal, transsphenoidal surgical removal is reserved for those who wish to get pregnant or those who fail to respond to bromocriptine. Acromegaly is recognized by the huge hands, feet, tongue, and jaws, and in the USMLE exam by the picture of a man showing both hands on either side of his face in the frontal view, and a long prominent jaw in the lateral view. Additionally, there is hypertension, diabetes, sweaty hands, headache, and a history of wedding bands or hats that no longer fit. Workup starts with determination of somatomidine C, and pituitary MRI. Surgical removal is preferred, transnasal or transsphenoidal, but radiation is an option. The somatic changes are irreversible. Pituitary apoplexy occurs when there is bleeding into a pituitary tumor, with subsequent destruction of the pituitary gland. The history may have clues to the long-standing presence of the pituitary tumor. Headache, visual loss, endocrine problems, and the acute episode starts with a severe headache followed by signs of increased compression of nearby structures by the hematoma, deterioration of remaining vision, bilateral pallor of the optic nerves, and pituitary destruction, stupor, and hypotension. Steroid replacement is urgently needed, and eventually other hormones will need to be replaced. MRI or CT scan will show the extent of the problem. Tumors of the pineal gland produce loss of upper gaze and the physical finding known as sunset eyes-Pernaud syndrome. Brain tumors in children are usually in the posterior fossa. Medulloblastoma is the most common type. It arises in the cerebellum and gives the classic cerebellar symptoms: such as stumbling around and truncal ataxia. The second most common type is a pandemoma. Some of those pivot on a pedicle, and affected children often assume the neatest position to open the flow of cerebrospinal fluid and relieve their headache. Brain abscess shows many of the same manifestations of brain tumors. It is a space-occupying lesion, but a much shorter timetable, a week or two. There is fever, and usually an obvious source of the infection nearby, like otitis media and mastoiditis. They have a very typical appearance on CT, thus the more expensive MRI is not needed. Actual resection is required. Thanks for watching our video and hope to see you again in next videos. Do not forget to see other videos in our channel. With my best wishes, Dr. Atef Ahmed.